Good morning, good afternoon, good evening to people around the globe. Thank you so much for joining us. It is my pleasure to welcome you all to this special event on the impact of COVID-19 in prisons, a topic which not only requires our urgent action, but which also necessitates a broader reflection on current state of incarceration worldwide. On a logistical note, I would first kindly like to ask all of our distinguished panelists to turn off their cameras and to mute their microphone and to only turn these on once you will be given the floor. Many thanks for your kind understanding. As the custodian of the UN Standard Minimum Rules for the Treatment of Prisoners, better known as the Nelson Mandela Rules, UNODC has alerted member states to severe risks which COVID-19 causes for those living and working in prisons from the outset of the pandemic last spring. In the meantime, however, prison overcrowding and poor health and sanitation conditions have contributed to a rapid spread of the virus amongst more than 500,000 prisoners worldwide. Uncertainties and anxiety amongst the prisoners have led to protests, riots, and other security incidents in prisons across the world, as we see in the news. Today's special event will give us the opportunity to not only look at COVID-19 preparedness and responses in prisons, but to also shed light on the systemic deficiencies which have rendered prisons so vulnerable to the pandemic in the first place. In our view, doing so is essential to mitigate current risks and to build back better by addressing chronic shortcomings in prisons and offender management. We owe this to more than 11 million prisoners worldwide and to those working in prisons, to the cohesion and safety of our societies, and to the pledge of the Sustainable Development Goals to leave no one behind. So we've been discussing these topics at the Congress throughout this week, but it is very useful to have a dedicated session with so many distinguished participants to zoom into this very urgent and current topic. So with this short introduction, it is my honor to now be able to share a statement on behalf of Ms. Ghada Wali, the Executive Director of the UNODC. I would like to mention Ms. Wali's warm greetings to the group and reassure her commitment to the group of friends of the Nelson Mandela Rules due to some logistical challenges and unexpected changes in her schedules related to various restrictions of holding a meeting of this scale under COVID circumstances. She was unfortunately unable to join personally, but she has asked me to convey her warm greetings to the group and to reassure you of her strong commitment to the group of friends of Nelson Mandela Rules. So allow me to share her statement to this event. Excellencies, ladies and gentlemen, the Nelson Mandela Rules for the treatment of prisoners represent a crowning achievement of the United Nations Crime Congresses. In 1955, the first UN Congress on the Prevention of Crime and Treatment of Offenders, as the Crime Congress was called at the time, adopted the standard minimum rules for the treatment of prisoners. This is in many ways how our discussion started on the Crime Congress itself. The United Nations Office on Drugs is proud to be the custodian of these landmark, universally recognized standards, renamed in honor of Nelson Mandela after their revision in 1915. In partnership with you, our office has promoted the practical application of the rules to improve the humane treatment of prisoners and their reintegration into our societies around the world. Last year, we marked the 15th anniversary of the Nelson Mandela Rules in the shadow of the global COVID-19 crisis. which has made tragically clear that actions to address prison conditions is needed now more than ever. Prisoners and prison staff have been hit particularly hard by the pandemic, and prison settings continue to be at severe risk of catastrophic outbreaks of the virus. Over-incarceration, overcrowding, poor prison conditions, and a lack of resources endanger the safety and health of 11 million people in prisons and those working in prisons, and they represent a serious threat to all communities outside the prisons. The majority of member states continue to deal with this acute issue of overcrowding, with more than 50 countries operating prisons at more than 150% of actual capacity, compromising not only the quality of nutrition, sanitation and hygiene, but also health, safety, and the care of vulnerable groups within prisons. The resulting pressure for both prisoners and prison officers fuel conflict and violence, undermining efforts to ensure a safe, secure, and humane environment. Protests, riots, and other incidents in prisons have erupted in over 50 countries during the COVID-19 crisis. UNODC has responded quickly to member states' requests for support to deal with these risks and challenges. Along with the UN system partners, including WHO, OHCHR, and UNAIDS, we have issued policy alerts and guidance on addressing the dangers of an explosive outbreak of the virus in prisons. Our office is currently helping more than 50 countries with training, personnel protective equipment, and healthcare assistance tailored to the current circumstances under the pandemic. We also welcome efforts by many countries to reduce the size of prison populations as part of their COVID-19 response. According to preliminary information, close to 700,000 prisoners have been authorized for release worldwide, and a typical focus on those who are especially at risk from the virus, who are approaching the end of their sentences, or whose release would not imperil public safety. As member states take such measures to tackle acute pandemic threats, let us also take this opportunity to rethink how imprisonment is used and to increase the focus on crime prevention and non-custodial measures for the longer term and for the benefit of all our societies. In this regard, I am pleased to inform you that the UN system is mobilizing its efforts around a forthcoming UN Common Position on Incarceration, with UNODC taking the lead together with the UN Division for Peace Operations and the UN High Commissioner for Human Rights. Guided by this common position, the UN will from now on focus on providing integrated assistance to member states to rationalize the use and scope of imprisonment, improve prison conditions, and strengthen prison management, and advance the rehabilitation and social reintegration of offenders. The practical application of the Nelson Mandela Rules, as well as the Bangkok Rules on women offenders and prisoners, and the Tokyo Rules on non-custodial measures. They will together save resources, protect human rights, and reduce reoffending upon release. Looking ahead, UNODC will continue to work towards expanding our global program on addressing prison challenges and our significant portfolio of field-based prison reform projects in all regions across the world. We will also seek to advance the use of alternatives to imprisonment, including by building the capacities of probation services and other criminal justice entities in charge of non-custodial measures, And we will support member states to improve case management and the efficiency of criminal proceedings in order to reduce backlogs and hearing delays. These are essential steps to relieve prisons and correction services from the pressures of overcrowding and from an over-reliance on incarceration. Furthermore, prison and penal reform will be a priority of our regional initiatives, including UNODC's Strategic Vision for Africa 2020 to 2030. That's just been launched at the end of last month. We count on the support of all member states for all this work, which we will pursue in partnership with you, with the UN and regional organizations, and with civil society around the world. Together, we can honor the legacy of the Crime Congress, as well as the memory of Nelson Mandela, and devote greater attention and care and resources to the plight of prisoners and to offender management as part of our collective commitment to truly leave no one behind and to strive for dignity for all in this decade for action in front of us. Thank you. It is now my honor to move on and to introduce His Excellency, Mr. Yasona Laoli, Minister of Law and Human Rights of the Republic of Indonesia, who will address us through a video message. I would like to take this occasion to express our sincere appreciation for the fruitful partnership between UNODC and the Directorate General of Corrections located under his ministry. We look forward to benefiting from Professor and Minister Laoli's insights and from the experience of Indonesia in addressing and learning from the impact of COVID-19 in prisons. Could we please proceed with showing the video, please? Many thanks.
Excellency Chairpersons, Excellency Ms. Garaweli, Executive Director of the United Nations Office on Drugs and Crime, Excellency Mr. Ronald Lamola, Minister of Justice and Correctional Services, Republic of South Africa, distinguished panelists, speakers, and delegates who are taking part in this event virtually. First of all, I would like to thank the UNODC and the Government of Japan for organizing this important side event and for inviting me to deliver a keynote speech. I was planning to take part physically in this forum, but I have to cancel the plan due to a strict limitation and restriction for participants of the Congress. I hope the virtual participation of panelists and delegates in this forum does not downgrade the importance of this event to discuss the impact of COVID-19 on prison management. It is indeed a forum for exchange of views and experience on how we can cope with formidable challenges in mitigating risk and applying appropriate measures in all prisons. I am pleased to share with you here the condition in Indonesia and the policy we have been implementing to prevent the spread of COVID-19 pandemic in the correctional institution all over the country. We use the term correctional institution instead of prison in Indonesia. The main problem for us is similar to what other countries have been experiencing. Prisons are overcrowded, where social distancing is hard to implement, and the risk of transmission of coronavirus is high. Limited space in our correctional institutions has caused overoccupancy and overcapacity. As we can see on the screen here, as of February 2021, there are 252,861 inmates in our correctional institutions all over Indonesia, while the capacity to accommodate them is limited to only 135,704. So I must say that the remaining 117,157 inmates are not properly accommodated. In some correctional institutions, especially in big cities, the rate of over-occupancy ranges from 300% to 600%. As of February 2021, those who have been infected include detainees, inmates, and correctional officers. 4,343 inmates, including children, have been infected. 374 are still undergoing isolation treatment, and 3,948 have recovered. 221 inmates died. 1,872 correctional officers were infected. 380 people are still undergoing isolation treatment, and 1,471 have recovered. 21 officers died. The Directorate General of Corrections of the Ministry of Law and Human Rights has been taking various strategic steps in order to prevent and handle COVID-19 pandemic in correctional institutions. Among others, 1. Coordinate with other institutions such as Ministry of Health, Indonesian COVID-19 Task Force, Police and Prosecutors, Supreme Court, WHO, UNODC, ICRC, and non-governmental organizations. 2. Update guidelines for the implementation of health services in correctional institutions. 3. Disseminate information on health protocols and new habits to prevent the spread of COVID-19 pandemic. 4. Intensify training at all correctional institutions, adapting to new habits. 5. No new detainees accepted from the police and the Attorney General's office. 6. Limit family visit and conduct virtual visit. 7. Carry out isolation for 14 days for new prisoners who are still in the trial process. 8. Monitor and evaluate the efforts. 9. Release a number of inmates with certain criteria based on the regulation of the Minister of Law and Human Rights of the Republic of Indonesia, number 10, 2020, concerning the terms of providing assimilation and integration rights for prisoners and children in the context of prevention and combating the spread of COVID-19 in prisons. Let me share with you further on this particular assimilation and integration policy. It is basically applicable for inmates who have served half of the sentence period and 1/3 for children. As of February 2021, under this policy, 61,633 inmates have been released and returned to their family. Released inmates are still required to virtually report to the parole officer until their sentence period ends. The ministerial regulation has been reviewed and considered effective in achieving its target to reduce the spread of COVID-19 pandemic, although it was found that less than 1% of the inmates has abused the policy and committed crimes again after the release. The policy has been extended by the new ministerial regulation number 32, 2020 until 30 June 2021. Under this new ministerial regulation, we simplify the mechanism for release and extend its application to foreign citizens who meet the requirements. On the other hand, in order to avoid repeating the same crimes by release offenders during the assimilation and integration period, this policy is not applicable for certain offenses such as premeditated murder, rape, violent robbery, and child sexual abuse. In general, the implementation of guidelines and health protocols for the prevention and handling of COVID-19 at Indonesia's correctional institutions have been proven effective to prevent the spread and transmissions among inmates. However, there remain challenges to be addressed, including Overcapacity in correctional institution, detention facilities, children correctional institution, lack of capable human resources in correctional institution, lack of budget, supporting facilities and infrastructures, limited support from the local health office and task force. We have been improving our infrastructures and facilities to address those challenges, which include building new correctional institutions as well as relocating and renovating them so that we can increase and double their capacity. The pandemic has also encouraged us to further review the prevailing system in Indonesia, particularly on how to use alternatives to imprisonment in order to avoid overcapacity in our correctional institution. More than half of inmates in Indonesia are drugs-related offenders. Some of them may need rehabilitation program instead of imprisonment. There has been intensive discussion to revise the drugs law as one solution to reduce overcapacity in correctional institutions. This effort becomes a national legislation priority, and hopefully we could conclude the process by the end of this year. Distinguished panelists and delegates, we need technical assistance and capacity building to improve human resources as well as the services and facilities of correctional institutions. In this regard, we highly appreciate the support from many parties, including the UNODC and ICRC office in Indonesia, for its assistance in providing personal protective equipment and hygiene kits for a number of correctional institutions and hospitals in Indonesia. We hope for continued support and assistance from different parties. There is no doubt that international cooperation is required to mitigate the risk and build a better prevention of COVID-19 pandemic. I hope we can have lessons learned from this forum and explore further potential of developing cooperation with other parties. Thank you.
It is now my pleasure to introduce the Honorable Patikile Horomisa, Deputy Minister of Justice and Correctional Services of the Republic of South Africa. In UNODC, we continue to feel privileged by the fact that the Nelson Mandela rules for the treatment of prisoners were named after the great icon and former president of South Africa. We are equally indebted to South Africa's able co-chairmanship in close cooperation with Germany, the co-chair, of the Vienna-based group of Friends of the Nelson Mandela Rules, which gathers more than 30 countries committed to promoting the Nelson Mandela Rules worldwide. Honorable Patikile Horomisa, thank you very much for being with us live, especially despite the nighttime in South Africa. You have the floor. Thank you very much.
Moderator, Madam Kato, Honorable Minister of Law and Human Rights of the Republic of Indonesia, Professor Yasona Lawoli, Executive Director of the United Nations Office on Drugs and Crime, Madam Gada Wali, Director General of the Corrections Bureau, Ministry of Japan, Mr. Satoru Ohashi, members of the group of Friends of the Nelson Mandela Rules, Excellencies, distinguished guests, fellow panelists. On behalf of South Africa, allow me to thank the United Nations Office on Drugs and Crime, which is coordinated by the Executive Director, Madam Gada Wali, for the opportunity to make a presentation at this special event focusing on COVID-19 in prison settings on the sidelines of the 14th United Nations Congress on Crime Prevention and Criminal Justice. On behalf of my government, we wish to express sincere appreciation to the government of Japan for hosting the World Crime Congress and for the excellent organizational work undertaken in this regard, especially during these difficult times of the COVID-19 pandemic. Unfortunately, myself and the minister were not able to travel to the beautiful city of Kyoto to be with you. I'm pleased to be a part of such a distinguished panel of practitioners and policymakers, including being graced with a presentation by the Honorable Minister from Indonesia, who has just addressed us. Indonesia, like many countries, played a pivotal role in the liberation of South Africa through its support for the anti-apartheid struggle. These bonds have been existing for centuries. South Africa's first democratically elected president, Nelson Mandela, paid homage to this contribution by Indonesia. Moderator, fellow panelists, since the beginning of the COVID-19 pandemic, the global community continues to grapple with the effects of COVID-19 pandemic, which negatively affects our health systems, economies, and the overall well-being of the citizens of this world. This pandemic knows no boundaries and affects us all. South Africa is no exception, and our government had to move quickly to address this challenge. In this regard, our authorities emphasize that it is critical that all individuals continue with strict adherence to interventions and protocols put in place by our government, which includes physical distancing, wearing of masks, and frequent washing of hands with soap and water, or regular sanitation of hands in order to minimize the spread of COVID-19. Although the country has started seeing a decrease in new COVID-19 cases after a vicious, severe second wave, scientists caution that a third and even fourth wave is looming. In managing this pandemic in our correctional facilities, the South African Department of Correctional Services developed the Standard Operating Procedures, SOPs, for preparedness, detection, and response to COVID-19. These SOPs provide guidance on mitigation strategies that must be implemented to prevent, detect, and respond to COVID-19 in correctional services. These SOPs were developed in line with United Nations standard minimum rules for the treatment of prisoners. These SOPs are also reviewed on a regular basis as required to incorporate new developments regarding the pandemic. It should be noted that South Africa has in place version 3 of the SOPs since the spread of COVID-19. This means that the SOPs are aligned to government strategy category of levels for lockdown. By the way, we are now on level 1 of the lockdown. Moderator, in terms of inmate population in our correctional facilities as of January 2021, it was just above 141,000. The COVID-19 reported cases of officials in the department were at 7,146 as at end of February 2021, which accounted for 0.47%. Inmates were at 3,951, which accounted for 0.26% of the South African COVID-19 positive overall caseload of 1,513,393. The COVID-19 related death was 169 for officials as at end of February 2021, which accounted for 0.33%, and inmates were at 69, which accounted for 0.13% of the total South African COVID-19 related deaths, which stood at 49,993. The low death rate is attributed to the various strategies implemented in the department to mitigate the impact of COVID-19 within our small facilities. Moderator, although there were challenges encountered in terms of overcrowding in some of the centers, as well as during the transportation of trial-awaiting detainees from prison centers to courts, whereby there was non-compliance with non-pharmaceutical measures of infection, prevention, and control, we have full confidence in our preventative measures and remain committed to the protection of inmates. In 2020, the United Nations High Commissioner for Human Rights, Ms. Michelle Bachelet, advised that under international human rights law, states have an obligation to work to prevent foreseeable threats to public health and ensure that all who need vital medical care can receive it. In addition, universally acknowledged UN standard minimum rules for the treatment of prisoners, also known as the Nelson Mandela Rules, set out the minimum standards for the management of prison facilities and the treatment of prisoners. Despite these rules being non-binding, South Africa holds the view that they set a minimum standard on how prisoners around the world should be treated in terms of their access to nutrition and healthcare, as well as incarceration under humane conditions, with a view to facilitating their reintegration into society upon release. Equally important is the safety and well-being of prison officials, who are tasked with enormous responsibility to ensure the proper functioning of the justice system. Moderator, fellow panelists, in responding to the call to protect prisoners and prison officials, in April 2020, the President of South Africa, His Excellency, Mr. Cyril Ramaphosa, granted an extraordinary special parole dispensation to reduce the inmate population as a measure to contain the spread of COVID-19 in correctional facilities. The President authorized the placement of parole for selected low-risk qualifying sentence offenders who have or will reach their minimum detention periods within a period of 60 months. The impact of COVID-19 is therefore seen in the lowest number of infections and deaths reported in South African correctional facilities. Moderator, given the limited availability of vaccines around the world, the Department of Correctional Services negotiated with the Department of Health to consider officials of the Department of Correctional Services during phase 1 of the national vaccine rollout, given the peculiar nature of prison settings. This inclusion of correctional frontline workers in phase 1 is based on the virtue of officials being at the cold face of service and can be linked with frontline workers as determined by the World Health Organization recommended COVID-19 vaccination rollout strategy. In South Africa, the Department of Health has begun the vaccination under phase 1. All health sector workers, including correctional services, have started to be vaccinated. Under phase 2 of the rollout plan, which includes persons over 60 years of age, persons under 18 years with comorbidities, and inmates will form part of this group to be vaccinated during this phase. This is one of the initiatives to ensure that you are aligned to the United Nations standard minimum rules for the treatment of prisoners. In conclusion, ladies and gentlemen, South Africa reiterates its commitment to continue promoting and ensuring compliance with the Nelson Mandela rules, which have gained even greater importance during the COVID-19 pandemic and has put an enormous burden on prison correctional services worldwide. We also invite other member states to join these efforts, including by considering to join the group of friends of the Nelson Mandela rules. We encourage member states of this forum to promote the core objective of the rules and applying these in relation to detention for persons in conflict with the law. This as well includes the consideration being given to the length of detention on remand and limited use of non-custodial measures. This will influence in building back better post this pandemic. I thank you.
Thank you very much. Thank you very much, sir, for your generous contributions. Thank you for joining us live. Our next speaker is Mr. Satoru Ohashi, Director General of the Corrections Bureau under the Ministry of Justice of Japan, our host of this year's Congress on Crime Prevention and Criminal Justice. Japan remains an important donor of UNODC's work in the field of prison reform, in particular in South and Southeast Asia. This support, for which we are very grateful, also allowed us to quickly react to the emergency needs in prisons which materialized during the pandemic. While Mr. Ohashi cannot be with us in person, he has shared a video message with us to celebrate on the Corrections Bureau's responses, elaborate on the Corrections Bureau's responses to COVID-19. Please. Thank you.
Thank you for your introduction. I'm Satoru Ohashi, Director General of Correctional Bureau, Ministry of Justice, Japan. First of all, I would like to express my deepest gratitude for the honorable opportunity to make a statement on behalf of the host country, Japan. The 14th UN Congress in Kyoto, Japan, was originally supposed to be held in April last year. It has been postponed due to the global pandemic of COVID-19. For the past year, we practitioners in the field of correctional administration have been searching for countermeasures against the spread of COVID-19 in correctional facilities, but still we are in the dark. Each member state has been confronting the pandemic by making full use of measures as much as possible, while being aware of our duty of maintaining security and discipline in prisons, offenders' rehabilitations, and their smoothly integration into society in different environments. Our challenges and efforts are still going on. Under these circumstances, the subject of today's workshop by UNODC, the impact of COVID-19 in prison settings, is a timely and notable topic for those involved in correctional administration around the world. I would like to give a big compliment to UNODC's initiative to deal with this challenging subject that all of us have been looking for the more efficient measure. In Japan, as of March 1st, 2021, 119 correctional staff and 256 inmates had been infected COVID-19 in correctional institutions. As a result of making efforts to prevent pandemics in situations by taking appropriate measures under the guidelines, which was newly formulated to prevent spreading COVID-19, fortunately, to date, our correctional administration has not become dysfunctional. In addition to comprehensive health management and hygiene management of staff and inmates at facilities, we implemented several countermeasures such as restrictions on visits, control of spacing during meeting and prison work, careful health check at the time of admission and release, as well as sharing medical information closely with related organizations. The spread of infection has not been completely contained. However, as a result of striving to maintain a system that allows us implement sustainable basic countermeasures against infectious disease based on our guidelines for a certain period of time, we recognize that our countermeasures have worked to some extent. Many people may agree that correctional facilities are extremely vulnerable to spread of infectious disease like COVID-19. Unfortunately, there is no complete prevention measures against infectious disease in prisons based on our experience of actions against COVID-19 in Japan over the past year. It is also true that in the midst of social turmoil caused by the spread of COVID-19, it can be quite difficult to provide the same level of medical care in prisons as in society. What we have learned from this COVID-19 pandemic is not only to take prevention measures as quickly as possible, but also to establish effective countermeasures in the event of infection in advance. It is also important to establish a system that can promptly secure the necessary personnel and supplies. Dear participants, I know through the media that the trial and error for preventing the spread of COVID-19 are being attempted in prisons worldwide, including your country. Especially in the condition of prison overcrowding, I am sure you have already noticed that the situation is beyond the control of the competent authorities, and the risk of being unable to maintain the minimum standard of prison environment we must comply with as stipulated in the Nelson Mandela rules and other international norms. In Japan, prison operations have not yet fallen into the pandemic crisis. Of course, this is because the basic countermeasures for COVID-19 are thoroughly implemented, but prison conditions that prisons in Japan are not overcrowded can be another factor for preventing the spread of COVID-19. Ensuring a certain amount of room for accommodation makes it possible to quickly and effectively divided areas in the facility when inmates are infected. It is also not difficult to replenish staff, so it will be possible to prevent spreading infections. It contributes to the operation of the prison without impairing its function. Prisons are always at risk of dysfunction if there are delayed on improperly responded to the spread of infectious diseases such as COVID-19 in a situation of the overcrowding. It makes that the prison's basic responsibility, including incarceration, rehabilitation, and social reintegration of inmates, may not be fulfilled. Up until now, measures against overcrowding have been widely discussed, as well as improving the environment in prisons. This is not just about improving and expanding facilities. It will also be necessary to improve social treatment and approach the criminal justice system to review prison incarceration itself. This issue should be considered by all practitioners involved in criminal justice, not just the correction authorities, because it also requires the promotion of understanding of the community and the general public. Dear participants, who could have predicted that this disaster would continue to this day? We believe that the vulnerable of the prison environment to infectious diseases expressed by COVID-19 is a factor that cannot be ignored in advancing criminal justice reform related to the administration of prisons and treatment of offenders in the future. Each member state will be able to properly carry out the purpose of the correctional administration in any environment, and through prisoners' rehabilitation and smooth social reintegration, our effort to realize peace, justice, and strong institutions outlined in Goal 16 of the SDGs will continue. At this ancillary meeting, I believe that the emphasis and solidarity will be shared among the correctional staff and other criminal justice officials around the world who are in struggle against COVID-19. I hope that the power to build a new concept of correctional facilities in a new era will be created according to each state's circumstances. I expected that UNODC, today's organizer, will listen to member states' opinions and provide strong initiatives and indicators for establish stronger correctional administration after the pandemic. Thank you very much for your attention.
We're now joined by Mr. Peter Severin, who is not only the Commissioner of Corrective Services of the state of New South Wales, Australia, but he also serves as the current president of the International Corrections and Prisons Association, Icpa, the only global network and forum for prison and corrections professionals. In 2019, UNODC was privileged to receive an Icpa Excellence Award in the category of prison management and staff training for our e-learning courses and the Nelson Mandela Rules, an important recognition which certainly encouraged us to further enhance our work in the field of prison reform. Mr. Severin, many thanks for having found the time to join us, and we look forward to listening to your global perspective on the important lessons that we need to learn from the severe impact of COVID-19 in prisons. Please, you have the floor.
Thank you very much, Ms. Kato. I acknowledge my fellow speakers and presenters. It's a real privilege and honor to be part of this very and most important session. And I particularly thank for ICPA to be able to also contribute here. That's really appreciated. As briefly mentioned, ICPA is a global network and organization association for corrections professionals from all fields, be it the public, the private, the non-government sector, and the academics. And in that context, of course, the pandemic provided a particular challenge for us to make sure that we very quickly harnessed all the expertise that we could possibly get together, combine it, collaborate, and I'll talk a little bit more about that. So in my 10 minutes, I will briefly touch upon how the response was managed to the pandemic across corrections worldwide, looking at collaboration and capturing the lessons that were learned, focus on the recovery, which is really a very important part of this journey, and then also briefly touch upon the opportunities for reform, for actually making something good out what was a very challenging and demanding period of time. So I think it's very clear that the COVID-19 pandemic is one that affects everybody. And while in prisons there have been pandemic plans resulting from previous threats in place, there were no plans that were specific as they needed to be in the context of COVID-19. So it necessitated reliance on what we generally knew would work in the practical context, but the risk and dangers that COVID-19 presented was really not fully recognized until it was already a real problem within a number of correctional jurisdictions. Interestingly enough, the earliest issues that were noted occurred in Europe, and then very quickly Latin America, and after that the United States and the rest of the world experienced some real challenges in dealing with the pandemic and the response to the pandemic. We already heard from the presentations from South Africa and from Indonesia in particular, and also Japan, about some of the immediate actions that were taken, and I won't go into too much detail on that. That included prisoner separation, isolation and quarantine, the ceasing of visits, transfers of prisoners between prisons, programs and group activities just simply stopped to be organized and run. But we also clearly identified the need to have a very strong focus on communication, making sure that all the new learnings were very quickly understood, by our staff, by prisoners, and also by those that make decisions, our politicians and other parts of government. So the focus on communication, that I will talk a little bit more about that in a minute, is one that is very, very important, continues to be important with all stakeholders. We also saw in many parts of the world an increased use of technology to be introduced very quickly to facilitate those things that weren't able to be done quite as easily anymore, court appearances and the likes. Also visits in some parts of the world were now facilitated via video conferencing, sort of that compensated to some extent for the lack of being able to visit a person directly in a correctional institution. We already heard about the Indonesian experience on the legislative response, and that's very interesting because we saw globally a reduction in prisoner numbers, quite understandably, and this was a result of the court system slowing down a bit, of curfews and lockdowns, resulting in a lower prevalence of crime. But we also saw very clear measures of early discharge, early parole in some parts of the world. And by and large, that experience has really shown the opportunities that exist for using alternatives to imprisonment. Because while we did it at the time in response to a pandemic, the real opportunity now exists to, like we heard from Indonesia, to actually look as to how that impacted on the overall crime rate. And if it didn't impact on the crime rate, it is an opportunity to actually inform future legislation and future policy development. Of course, we can't ignore the fact that we also had to deal with prisoner unrest as a result of those restrictions, and also a result of the very restricted lockdown and isolation regimes that had to be introduced in some parts. And that prisoner unrest, of course, was an added challenge for the staff in corrective services. Icpa at the time very quickly responded by facilitating a global dialogue, and we certainly also worked very closely with UNODC and the ICRC and wherever that was practical, supported efforts that were made either through expertise that we could bring to the table or through some very practical engagements. We created a COVID-19 prison task force, and that task force, while not as active any longer as it used to be, is still in existence, and I'll talk about that in closing. It allowed really everybody to very quickly become aware of good practice in responding to the crises, good practice in looking at opportunities to inform our practice better, and to very quickly move to a as professional as possible response that we had to mount very quickly. You'll find all those resources, very practical resources, on the Icpa website, and that's really a very rich repository of excellent publications and tools for practitioners. It includes a modeling tool, and this modeling tool is really it was important at the time when we had to convince governments about the necessity to take this very serious in the context of prison. It actually allows you to model the impact of an outbreak in any facility by simply using the demographics of the prisoners, by and large, the size, the type of facility, and then the model actually identifies what actions you need to take to limit the spread of the pandemic in that particular institution. That very clearly is an evidence-based tool. It's again freely available on the Icpa website, and it will hopefully continue to be used in the context of making policy decisions, and you basing those on an actuarial tool that is being developed in the tertiary sector. We're coming to recovery now. So recovery means that obviously in the context of the pandemic, now hopefully being able to be better managed through vaccination programs, and those are at this point in time, unfortunately, not very consistent around the corrections world. We have some examples of excellence where prisoners and staff working in prisons are prioritized because of the high risk that COVID presents to prisons. In other parts, these vaccination programs are a lot more difficult, particularly in developing countries, to implement. And we can't underestimate the need to do that well. It's important that we develop plans that actually see us gradually moving from our current regime back to a more normalized regime. It is important that we continue to communicate really well with all the stakeholders, be it prisoners, staff, families of prisoners, other stakeholders, governments. So because the new normal will not be as the old normal was, there will be clearly some opportunities to continue with certain measures in the management of our facilities that actually make good sense, be it from a hygiene perspective or a normal routine perspective. But it is important that we plan very well for recovery. And then I come to reform. There are certainly opportunities, and I mentioned legislative opportunities before, and particularly the use of technologies, where we can use the learnings from the pandemic to inform a package of reform going forward. We can inform, based on evidence, our legislators about opportunities to actually facilitate a decarceration program where that is responsibly able to be done. We can look at the evidence that we have gained since the pandemic started to back up those type of opportunities in the reform space. So in closing, I just again focus on what ICPA is able to contribute, and everybody is welcome to contact us. You find us on the internet. We are organizing a peer support arrangement as part of the ICPA COVID-19 prison task force that will provide experts, access to experts for anybody who's got a particular problem. There can be health specialists, operational experts, policy or legislation specialists, and we will continue to work closely with our partners in the ICRC and UNODC and other parts of the United Nations. I think mutual exchange and support continues to be most essential to achieve the best outcomes for prisons worldwide in combating COVID-19 and achieving, hopefully, a much better outcome for the future. Thank you very much.
Thank you very much for this rich contribution, and also for highlighting our ability to turn this crisis into opportunity for building a better future, and the practical elements of this in relation to our topic today. Thank you very much. I would now like to turn the floor to our last panelist, Mr. Vincent Ballon, head of the detention unit in the Protection Division of the International Committee of the Red Cross, ICRC. In light of its extensive work on detention across the world, ICRC is an essential partner for UNODC, and we are grateful for the continuous coordination of efforts. ICRC also enjoys observer status within the group of Friends of the Nelson Mandela Rules. In the course of his career, Mr. Ballon has visited places of detention around the world, and we look forward to his take on how to best mitigate risks and build back better from the pandemic as far as the prisons are concerned. Please, you have the floor.
Thanks very much, Ms. Kato. Your Excellencies, ladies and gentlemen, a very good morning. It's a pleasure and an honor to be part of this panel on COVID-19 with such distinguished and experienced speakers. I would like to warmly thank our host UNODC for this invitation to this meeting and all those involved in the organization. Peter, you have covered a large spectrum of what has happened globally in this past year, and I will try to build on this from a risk perspective. Next slide. Let's first consider a few factors that are key in mitigation and building the new normal. Of course, the situation has been absolutely different in each country. Even with one country, there has been large discrepancies. For example, each penitentiary authorities had to adapt in accordance with the way its own authority had decided to shape the public health response. the diversity of situations will remain. Interestingly, we could see that the level of development of a country was not on its own a good indicator of the capacity to prevent and control the pandemic in prison. The COVID-19 prevalence and the risk inside and outside places of detention were not always correlated. More timely, reliable, coordinated, and disaggregated data are needed in order to identify and weight the relevant risk and take the right mitigation measure. We could see the differences in level of preparedness for dealing with such a pandemic. We witnessed difficulties linked notably to three elements: the lack of infrastructure necessary to allocate adapted space for isolation or quarantine, the challenge faced in addressing an emergency situation when both staff and detainee become vulnerable at the same time. And the third one is the lack of sufficient operational connections between public services, especially between the Ministry of Health and the other actors under the Ministry of Justice. Between February and May 2020, as prevalence was growing and with a high unpredictable situation, the main strategy has been to avoid the risk, often by complete lockdown, implementing a high level of restriction, suspending many services. However, we have seen that when authorities were acting progressively, step by step, and with proportionality, this created a much more conducive environment for staff, families, and detained persons to be themselves more aware, more trusting and confident, and thus better prepared and better organized. This will be key in the transition phase. Finally, there has been numerous examples of approaches which included consultation with and the participation of detainees. It demonstrated that through empowerment and community-based health and hygiene promotion program, results are faster and more sustainable. Next slide, please. In risk management, there are traditionally 5 categories of strategies to manage the risk: avoiding, eliminating, reducing, transferring, and accepting the risk. In the past year, we have learned that it is very difficult to be conclusive on the efficiency of one strategy over another. Often strategies have been combined to complement each other and adapt to the progression of the virus. However, some were largely inefficient as they were implemented hurriedly and in isolation. Some strategies did not consider some extremely important and foreseeable risks. This led to complete lockdown of detainee and staff, heavy and sudden restriction, and even complete suspension of services, such as family visit, even though we know what an essential lifeline such visits can be in many detention systems, delivering food, medicine, psychosocial support, for example. We witnessed very few closure of facilities limited to immigration detention. Again, on the subject of equity in addressing risk, as Peter was emphasizing, an important question remains as to whether detainees will have access to the COVID-19 vaccine, in line with the risk elimination strategy that has been applied to older people in the similarly closed setting of home for the elderly. The strategy to reduce the risk through prevention and control was probably fairly adequate. However, to be efficient, it required a good level of preparedness and a fast reaction. We often saw that it took time for prison services to be considered by national task forces, build protocols, mobilize additional emergency resources, and activate operational and multidisciplinary coordination. I won't be able to detail here, but the successful strategy to transfer or accept the risk, they were mainly seen in countries that had already good system in place and or who encountered very low prevalence and could then contain COVID-19. Next slide, please. What are the risks still to mitigate today and the ones that bear a high impact and high likelihood? In the case of COVID-19, the short and mid-term major risk remain the health-related risk on detainees and staff until it reaches an acceptable level or normalization with an effective epidemiological control throughout the society. However, what of the risk to mental health? This will last longer. Detainees will not have seen their family for a long time. Families and communities will have lost their income and experienced their own trauma. Coping mechanisms will have been disturbed. Detainees will be anxious and desiring to return to a previous situation which is no longer exactly the same. These are among additional risks that will need to be mitigated in relation to the life of detainees. The reading of the February 2021 report from Her Majesty Inspectorate of Prison in England and Wales entitled "What Happens to Prisoners in a Pandemic" is a very interesting deep dive into this concern. There are growing health risks coming from lack of access to courtyard and sport activity, and lack of access to preventive and curative healthcare for non-COVID related disease. This, of course, mirrors what is currently happening in communities outside. It will typically be exacerbated for prison. Probably the key to mitigating the security risk linked to detainees' fatigue at imposed restriction is communication. Communication about and active participation by detainee and their family in the discussion about contingency planning and implementation of further restriction. Any contingency plan should include a return to normalization plan that offers a positive and realistic vision of the future. In several countries, the situation in prison has been extremely difficult and well documented. The reputational risk of a prison system that showed itself unable to provide a human and safe environment will surely create an extra anxiety for future people incarcerated. Next, please. Among the several challenges and setbacks suffered by penitentiary authorities, some opportunity exists for the future. As we heard on Sunday during the side event on the 5th anniversary of the Nelson Mandela rules, COVID has been a wake-up call for, one, a faster and thorough implementation of the Nelson Mandela rules, and secondly, a review on the use of imprisonment and the activation of decongestion mechanism. This proved that it is possible to limit the use of incarceration, and that most states have the capacity to reduce crowding if they wish to do so and allocate the necessary resources. It is definitely an opportunity to address overcrowding sustainably, including through reviewing the Tokyo rules and developing a very practical, evidence-based approach towards non-custodial measures. As we have seen before with tuberculosis or Ebola, for example, in the field of health, prison has no wall. With COVID-19, we have yet another opportunity to create a much stronger bridge between detaining authorities and health authority. The World Health Organization, the ICRC, the International Correctional and Prison Association, the UNODC, the UN Peace Operation, and many other actors, international, regional, national, and local, have been mobilized in this direction. Speaking now of technical connection, their ability to help provided online services such as family contact, access to education and justice showed its value. Connection through technology should remain strictly complementary to physical and material service delivery, to allowing meaningful contact between staff and prisoners, and for family visit, lawyers, and access to court. I would like to emphasize here that the peer-to-peer exchanges energized by the International Correctional and Prison Association, but also the European Network of Prison Professionals, Europris, and the information sharing organized by various global and regional platforms, such as Prison Insider, between March and June 2020, have contributed to an efficient level of knowledge exchange to raise awareness and inspire action. This Congress is another example of cooperation on a global scale, which should be celebrated and nurtured. There is an amazing amount of material and practice emerging from the pandemic that I hope will be subject to quantitative and qualitative research, which will give us an evidence base from which to act in the future and therefore build back better. There are several interesting calls for action in the Kyoto Declaration or voiced by various participants to this UN Congress. The fear is that the new normal would not be a new improved normal if access to vaccine, healthcare, access to technology and connectivity remain discriminatory, if security policy sustained restrictions that were aimed at being temporary, if the back to normal for detainees and staff is considered a 3-step backwards, if other risks as described before, are not timely mitigated in the transition, and if the transition fails. Last one, please. In conclusion, the question is, what does building back, or the so-called new normal, look like? The 2030 development goals fix the frame for this conference. For the health risk from a pandemic, we could propose 5 visions. The first one, a situation in which the new normal is based on constantly improved capacity of detaining authority and their staff to handle emerging critical situation, and to do this within Nelson Mandela rules and other applicable law and standards. The second is a situation in which the resilience of detainees and their families and communities has been built, and they are active actors in their own protection and in the system response. The third one, a situation in which COVID is managed as a normal, eventually regular and controlled epidemic through adequate, inclusive and equitable public health policies and investment. The fourth one is a situation in which future pandemics are well prepared for and anticipated in our prison management, criminal justice system and societies. And the fifth one, a situation in which health risk and vulnerabilities present at all times are better identified in this system, honestly evaluated and reported, and reduced to a residual minimum while still respecting other human and procedural needs and rights. Importantly, we would call for one overarching and definite element in the new normal in the way societies use incarceration. I thank you very much.
Thank you very much for providing all the elements that we really think is useful for us to be able to look into in terms of what we can also follow up. I would like to take this opportunity to thank my colleague Philippe Meissner and Valérie Lebeau, who's been working very hard to put together this event, which of course is a reflection of our daily work throughout the year, not just for the Congress, to shed light and bring needed action on this very important topic. So thank you very much, colleagues, for all the hard work that goes into being able to present such a great group of expertise and insights. And if I may, that brings us to the end of the prepared panelists. But may I also invite our dear colleague from the Office of Chief of the Justice and Correction Services of the United Nations Department of Peacekeeping Operations, Robert Pulver, who of course we have the pleasure of collaborating on multiple issues, but obviously very important on this topic. So I understand Rob is also online. If we can hear some of his words to enrich this discussion, that would be great. Please, Rob, you have the floor.
Thank you, Madam Chair, and thank you, distinguished panelists. But thank you for the opportunity to take the chair. I'll keep my comments brief, and it really is all about this valuable partnership. I serve as the head of the Justice and Corrections Service in the Department of Peace Operations. We work together with UNODC, UNDP, OHCHR, UNITAR, and many other partners to support prison systems in host countries of the United Nations peacekeeping operations and special political missions. I would like to briefly mention measures that we have taken together with these partners and with generous support from many donors and from the Group of Friends of Corrections to help mitigate the impact of COVID-19 on prisons in the host countries of United Nations peace operations. This UN system partnership has led to several steps. One is advice to host countries on prisoner release programs and COVID prevention. A second is a remote hearing toolkit, which was developed also with UNITAR. The distribution of personal protection equipment in 16 countries, supported by UNDP and through the Global Focal Point for Rule of Law. An operational toolbox, COVID-19 preparedness and responses in places of detention, which has been translated in over 10 languages and distributed to resident coordinators throughout the globe. My screen background is actually one of the prison education posters from the toolkit. We've also been able, through this partnership, to engage the NGO Health Through Walls on the management of communicable diseases, health and hygiene practices, providing this advice to field components. My colleague will attach these documents to the chat, so they will be easily available to you. But I'd like to say that all of these approaches, as other speakers have said, will also be very important in post-COVID times. Of course, decongestion of prisons consistent with the new common position of the United Nations on incarceration, improving health and sanitation, and the appropriate use of technology for remote hearings. In terms of building back better, and I'd like to mirror what the previous speaker said, Monsieur Ballon, avoiding the back to before, or avoiding just the back. So building back better, 5 key points. One is the linkages that have been formed between prisons and national health authorities that have been strengthened during this time can continue to be strengthened and be maintained post-COVID crisis. 2, efforts to decongest prisons through fast-track remote trials can be continued to address the overuse of incarceration and delays in criminal justice systems. 3, efforts to strengthen prisoner health care should continue in order to better address other public health challenges, including tuberculosis, scabies, Ebola. 4th, remote court hearings will help provide access to justice in remote areas of countries that may have otherwise lacked that access. And finally, the visibility of the plight of prisons and prisoners has been heightened through this crisis, but we hope that we will, working together, be able to maintain that visibility going forward, even after the crisis. And I'd like to thank you for this very valuable opportunity and discussion.
Thank you very much, Rob, for your kind contributions. I would like to echo that COVID-19 has illustrated more clearly than ever the serious price to pay when prisons that are overburdened and ill-equipped, under-resourced to start with, are confronted with pandemic or other big crises as we are seeing now. The need to address over-incarceration, overcrowding, and its root causes should therefore come out as one of our main priorities in terms of future reform efforts. Rest assured that UNODC will redouble our efforts to keep prison management in line with the Nelson Mandela rules high on our agenda, and to continue to assist prison services to generating positive changes around the world on the ground. Importantly, however, we will also work towards diversified, individualized, and proportionate criminal justice responses to offending, including by exploiting more fully the potential of non-custodial measures. I think in this context, it is very encouraging that we will be working as UN system to be producing as it was referred earlier, UN system's common position on incarceration, which will also shed much more light for UN across the world, across the agencies and departments to bring added efforts to address these challenges that goes beyond criminal justice and rule of law responses. So more to come on this front as well. It is our firm conviction that reducing the resort to detention and imprisonment will constitute a precondition in many countries to enhance their resilience of prisons against the COVID-19 pandemic and other types of crises, and more broadly, to ensure progress towards effective criminal justice systems which are fair, humane, and people-centered. I trust wholeheartedly that this discussion we had today in this event will contribute for our common efforts of advancing this on day-to-day terms and on reflecting on all our work. which is a very important outcome to come out of this 14th Congress held in Kyoto. So thank you very much to all distinguished panelists and speakers, as well as to all of you who were kind to join in this hybrid format as participants. I hope we'll have many more opportunities to engage and have interactions to see how this could be advanced leading up to the next Congress in 5 years' time. So thank you very much once again for joining us from around the world, and we look forward to concrete follow-up together with everybody linked to this event. Thank you, and wishing you a wonderful day. Bye-bye.